Windsor Essex Community Health Centre, known as WECHC, provides patient care by breaking down as many barriers as possible, by meeting our clients where they're at, and by looking at the entire client, treating them holistically and involving them in their care.
We don't say no to a lot of people. Our programs and services are offered to pretty much anybody. Although our catchphrase does say supporting the vulnerable, but who hasn't been vulnerable at some point in their life?
Windsor Essex Community Health Centre defines vulnerable patients as those that have some challenges navigating the healthcare system.
Every other door in the city of Windsor has been closed for those clients, and yet here we are with open doors and open arms. Come on in. Where are you at? Let's get you started on something today.
We try to accommodate their needs. They may have a difficult time making an appointment. We try to get at least a nurse to see them, or at least a secretary to address their needs and try to arrange an appointment. So if they can get the confidence to walk in the door, we try not to turn them away.
And that's why we're here. We're here to kind of pick you up and walk that journey with you until you feel strong enough to stand on your own.
Windsor Essex Community Health Centre has 6 different locations that provide different services.
Street Health is right downtown, so they offer specialized services for the homeless or at risk of being homeless. The doors are open for them. They feel comfortable, they feel welcomed. They're often not necessarily the client that, say, a mainstream doctor's office would want.
We can offer point-of-care hepatitis C testing. We also have an naloxone program for those who overdose on opiates. We offer education, food, sometimes mittens, hats. We have wraparound services at Street Health that includes nurse practitioners for primary care, social workers, RPNs, foot care services. We listen to the clients and see what they need, and we can offer it the next time. So we have that holistic care at Street Health.
And then we have our Leamington site. It's servicing the entire town of Leamington and surrounding areas, with kind of an emphasis on guest workers, or formerly known as migrant workers, as well as the low German population, because those particular populations don't have a lot of services available to them.
They have a Leamington mother and baby program that works with new mothers and their children.
It's a really convenient location. We're right downtown in Leamington, so a lot of our people who maybe have barriers like transportation have access to us. We all do go into the home if there is a barrier there for a client and they can't make it in themselves.
At Teen Health, we have all services from physicians, psychologists, social worker, dietitian, workers that work with youth in terms of motivation and counseling. So it's not just, do you have a cold? It's always, what else is going on? Is there something you're concerned about? Is there something we should address? The beautiful thing about Teen Health is it doesn't discriminate. You might be sitting beside somebody who's living on the street, and then the person beside you might be living in Russell Woods. Every child that walks in that door gets the same non-judgmental, comprehensive care.
We have the Diabetes Wellness Program for patients who have been diagnosed with diabetes.
And they have a social worker on staff, so if you're struggling with your daily life, she kind of can help you with some of that stress and negativity, while a dietitian or a diabetes specialist helps you with some of the medical aspect of it. Right around the corner at Pickwick, you have the Active Aging Program, where they offer chronic disease management programming right out of that building, as well as primary care services.
The Pickwick location works with a lot of the new Canadians. A lot of the care that's provided there is provided through the use of translators. I've been told stories some days about translators coming in with 5 different patients with 5 different languages. So it's a very, very unique way to deliver care.
Sandwich is able to offer primary care services, social work, dietary services, chiropody, wellness programs, exercise programs. We're also in the community, so our clients may not be able to get to that building because of lack of transportation. We'll go and offer a program on the other side of the city so that it's accessible to that particular client or that group of clients that can't get there.
Wraparound care is something that exists at all of our sites, and that is an entire team of health professionals. So the physician, the nurse practitioner, the nurse, the dietitian, the health promoters, addressing the entire patient, all needs, and providing that care as much as possible in one area.
You can have one client seeing many people in the building and attending many programs, and all of us are able to communicate with each other, confidentially of course, about the best course of action for those particular clients.
We want to look at not just primary health care. We don't want to just treat the body. We want to treat the mind, the soul, the spirit, so that they can recover not just physically, but also mentally as well.
If a client comes in, let's just say for a simple cough or chest infection, if we just treat that single disease, it doesn't mean that we're treating all the other factors that led up to this issue. Why they get this chest infection? Are they homeless? Are they living in a shelter? That's why we need that whole wraparound care to take care of the other issues that led to why this client came in. As a community health center, we want to do as much as we can, but the reality is that there's other expertise in the community. So if we have those great partnerships, then we can provide the best care to our clients.
Meshing that care throughout the community just betters the community as a whole.
Every day I still meet people who have no idea who WECHC really is and all of the wonderful services that we have. And I just think it's great to see when we can get people to understand what we do, because a whole new world opens up for them.
We're the best kept secret in Windsor. All of the services that we provide, the wonderful staff that work with us. Never in my career have I worked with groups of professionals that have been so focused on the patients that they serve.